Dr. Gary Simonds is a neurosurgeon. He's retired now. He now teaches at a university, but 3 years ago he retired. But we talk about burnout and what happens to those medical school. After medical school, you go into your discipline, and it's just, he was saying how he just slept every third day. I opened up with I don't know if you ever heard the term, the suffering contest. If you do this sometimes with your friends or you hear people do it, I had a terrible day, well, I had a worse one, and how that gets manifested in burnout, and how to deal with it, and the resilience against it. He's written 3 books on burnout. He's written also a fiction book. Now that he's retired and he's teaching it now, what are some ways for him to be resilient and avoid burnout? But he's wonderfully gentle, sincere, smart man. I also ask about just general hubris with neurosurgeons. They have the reputation of somewhat being having hubris. We talk about that as well. He went into medical school, by the way. Before he took a lot of religious classes, and he was wondering about going into the ministry. So I asked about the kind of Venn diagram of science and spirituality. I wonder where it is with you. Is it just barely covered? Is there a huge overlap? But his input on it is refreshing, and I enjoy his perspective. Really great conversation with Gary Simonds. Really enjoyed it. Thanks for listening. Hi, I'm Joey Pinz. People ask me, how did I lose 130 pounds? The quick answer is always discipline. I started my business, wasn't paying attention to my health, was eating too much, drinking too much sweets. My daughter was born. Next thing I know, I'm pre-diabetic, I have hypertension. I knew something had to change. Discipline. I, like many of you, have faced many challenges in your career, in your family, in your life, in your faith. How did you attack them? How did you approach them? How did you solve them, hopefully? It all had to have some degree of discipline. I'm also asked, how did you found and start a tech business that lasted over 25 years? Discipline. I was committed to it, enjoyed technology, didn't enjoy some aspects of it, but knew it was necessary. Discipline. Our podcast mission: how do we use discipline to better ourselves and society? Join me, please, as I talk to interesting people and discuss how they use discipline in their family, in their passion, in their careers, and how it helped them. Our podcast vision: growth through learning from others. Joey Pinz Discipline Conversations. It'll be light and serious. Join us, please. Thank you for consideration. Gary
Sounds
Simonds.
good.
Yeah, I really appreciate your time today. Very, very excited to talk to you. What is the suffering contest?
Well, it's a concept that I think a lot of people can relate to. It's certainly a big deal, I think, in my world, the medical world, where it seems like at a certain point, um, life is miserable enough on the job that people start taking pride in how miserable they are, and they try to out misery each other. So and I think we see this in all industries, by the way, but I think what happens is, you get the people who are, I was here till 8 o'clock last night. Yeah, well, last week I was here till 9, 3 times. And it just goes on and on. Who can be the first in and the last out? And, the person who is just hasn't seen their family for weeks and all that sort of thing. And it just becomes a contest, and it's a contest of misery, which makes no sense. We're celebrating the antithesis of what we should be celebrating.
Yeah, and what do you think ultimately is I know, because I think I may have participated in it, inadvertently, but I do see it happening, especially in the corporate world. I mean, is the ultimate, like, I deserve more sympathy because I'm winning this contest, or I just win because it's a competition? What do you think the ultimate result of this is, Gary?
Yeah, I'm not sure if they're going for the sympathy. It certainly could be a component of it. I think there's some twisted machismo in it as well.
Mm.
I think the influence of men has been intense through the years, and we just want to be tougher than anybody else. We want to
Mm.
have the most scars.
Kind of fascinating background. I mean, you're a doctor, you're neuroscience, you're a neurosurgeon, but your journey there, I thought I heard you say at one point you were actually considering the ministry, and then you went into like family doctor, and then you graduated, and then you finally stumbled upon this and changed your where to go to school post medical school. Tell me about it.
Yeah, well, I think you just had it in a nutshell. But I when I originally went to college, I was definitely thinking of the ministry, um, and exposure to a fair amount of religion courses may have
Mm.
changed my thinking on that a little bit. But
Mm.
it was always there as a possibility, and I played with the idea of medicine. And I think all along, actually, the juxtaposition between religion and spirituality, if you will, and science was interesting to me. So I was a biochemistry major as well as religion, um, and eventually kind of got pulled more to the medical side and went to medical school. And when you're in medical school, you get exposed to all these different specialties. And I don't think it was uncommon at all for people to go through various incantations of what they were going to be. And I started out as a family doc, I think, and then I was going to be a cancer doc, and then a general surgeon, and then I eventually settled on cardiothoracic surgeon. I was going to be a heart surgeon,
Mm.
and had everything lined up. So after medical school, you have to go train in your specialty, and that can be anywhere from 5 to 7 or 8 years of postgraduate training. And I had it all set up. I was all prepared to go. And in my last month of medical school, I saw my first brain operation, and it was just like the scales fell from my eyes. I was like, "Oh my God, I have got to do that." But I use it as a warning to the pre-meds and the med students, because it was the stupidest thing I could have possibly done. Because
Mm.
I just dropped everything, ran around to find where I could train in neurosurgery at the last minute, and had zero idea of what I was getting myself into. And I was getting myself into a lot. Somebody once said coming on a neurosurgery service is like stepping onto a moving train. And that's
Mm.
precisely what it was. I mean, it was just full speed ahead right from day one. Lots and lots of hours, talk about suffering contests, but
Mm.
110 hours a week in the hospital, and no sleep every third night, and that sort of thing. But
Jeez.
and I tell that story though because um, I tell people, yeah, it was really dumb what I did. I lucked out. It worked out great because I can't imagine doing anything else. But what I tell them is, I still believe in following your heart, but try to check it out before you make the
Mm.
leap. Do some research as well as following your heart when you make your jumps into your careers.
Did you get to a certain point where you thought you shouldn't have gone into this area?
No,
Uh.
I mean, yeah, I mean, every middle of the night at 3 in the morning when you hadn't slept for a few days, you
Wow.
often would certainly be questioning your existence and why am I doing anything? But the
Wow.
reality is, I mean, once I was in it, I knew there was no other field in medicine that I would do. It's too awesome. I mean, neurosurgery is just an awesome field, and you deal with great people on every level, and the patients are fantastic. So I just can't imagine doing anything else.
Mm. And what ailments are you relieving? Are you treating in neuroscience?
Well, in neurosurgery, and there's a differentiation to one degree or another between neurosurgery and neurology. They're both,
Ah.
specialties that deal with ailments of the brain and the spinal cord and the nerves. But what I try to, and it's blurry. It's not always as distinct as you would like to think. But the way I try to explain it is neurosurgery tends to deal with disorders and diseases that are more what I would call structural, meaning there's something there that you can manipulate or take out. So let's say a tumor, it's there, there's a mass, there's a presence to it, and I can go in and try to take it out as safely as I can. Or a hemorrhage or an aneurysm, or brain injuries from a car accident or swelling of the brain. These are all things that you can physically do something to, in other words, with your hands and instruments and stuff. Whereas there are a lot of neurologic diseases. Think of MS, multiple sclerosis, for example, which is where the insulation of your nerves is stripped by your immune system. And there, I can't go in and re-insulate those microscopic wires. So any sort of treatment there is going to be on the medication level, and that's
Mm.
more in the neurology side of the fence. But we work in tandem quite a bit.
Amazing. I mean, I've seen, video of just open surgery on the brain like that. I mean, I don't even, could you possibly describe it to somebody? I mean, what's that like going into somebody's brain?
Yeah, it's like I said. I mean, the first time I saw it, I think I almost fainted in just how awesome it was. Just to think of, what's going on in there, and kind of the responsibility that you have when you're dealing with it. But I think it's something that you really have to put a lot of that awe aside when you're actually working
Of
on it, and
course.
you
Yeah.
become much more kind of technical in nature, and you're constantly thinking, okay, what do I have to do next? And a large part of what you're thinking is also, okay, how do I avoid this trouble? How do I avoid that trouble?
Mm.
And it's 7 years of training to do it. And I think you're learning for another decade afterwards. At least you're learning every day for your entire career, but I think you're really still on a steep slope for many years after even the end of your training. But you make it very technical. You learn all the anatomy, the way to deal with things. You have certain ways that have been worked out through decades of hard work of all the people who came before you, and newer technology, at least, to throw at it.
Mm.
And so I think you, more than anything, you make it into a technical exercise and try to leave all the emotion
Right.
out of it. Because if you stop and think for a minute, oh my gosh, if I do this, I could kill this patient, or
Mm,
I could
mm,
paralyze
mm.
this patient. I'm afraid it would impact what you're doing. So you almost become a little bit cold and calculating while you're doing the surgery. Not really allowing the implications to soak in.
Right. Right. Yeah, you can't let that kind of cloud. And how has technology, helped throughout even throughout all your training? I mean, technology keeps on advancing. I'm sure the tools get more sophisticated. I mean, is if you went to school right now for what you did versus when you did, how different is it because of technology?
Yeah, it's interesting. It may even be a bit of a two-edged sword. So forgive me, I'm probably going to prattle on a little bit about it, but it's
Please.
really interesting. For example, when I started in neurosurgery, MRI scans, the scans that we use for everything now in terms of the brain and the nervous system, at least, MRI scans were brand new. We weren't using them that much. We had CAT scans, but the typical CAT scan even took 20 minutes to take a picture of a brain, as opposed to now you put somebody in the CAT scan and within seconds the pictures are coming up. Everything is
Wow.
accelerated. But MRI is just stunning at how good pictures it gives of the brain. And now we're even able to look at some of the physiologies of the brain and stuff. But what's really changed, I mean, we still through most of my career, did surgery pretty much the way we always used to. I mean, it's pretty similar to the way it was done 40, 50 years ago. Um, but anesthesia has become much more sophisticated,
Mm.
so there's a lot less risk on the anesthesia side, and antibiotics and all that stuff we have going for us. But what's really happened of late are a couple of major things. One is we have what's called neuronavigation. And these are systems where there are infrared cameras up, and you have these wands, if you will. It's just like a pen, but it's like a wand, and you can point it somewhere on the patient's head or in the head, and up on a screen it will show you exactly where you are on the MRI.
Wow.
So getting to things that are deep in the brain or under the brain or something like that, you literally can follow the wand. uh,
Unbelievable.
and so it really changes the dynamic of how you get to places, because in the old days, I mean, through much of my career, a lot of it would be a little bit of dead reckoning.
Mm.
I've learned enough that if it's in this location in the brain, I make a hole here, I make a hole here, or a window or whatever.
Mm.
And now, I mean, you can really be very specific about where you entered, and that sort of thing, and that minimizes the amount of dissection you have to do and stuff like that. So it's pretty wild. The two-edged sword about it, though, is like with my trainees, I would always make them at least show me how they're going to get there without the system, because I always am fearful if technology has a hiccup, and it does sometimes, or it's misapplied, or something happens, there's a short circuit or whatever. You worry that if you've always used it, it's like using your GPS. If you always use GPS,
Mm.
you're not as good at finding your way around places, and so I do
Mm.
think there's a little bit of a problem there. Sometimes I think we have to use the force, if you will,
Mm.
or whatever, to get there. Then the other big thing that's happening in that world is what we call minimally invasive surgery, and there are many different formats. But for example, an aneurysm it's like a blistering off of a blood vessel in the brain, at least. It's like a blister, and it's very thin walled, and they can explode. And if they explode, if they pop, blood goes pouring into the brain, and it kills a lot of people. And if you survive it, it will happen again. And so it needs to be that blister needs to be obliterated one way or the other. And what we used to do is take these little spring-loaded clips with jaws, and you would put them around the blister. You would secure the blister away from the blood vessels so blood couldn't get into it. Um, and what came along are treatments where they take catheters, these long, skinny tubes, put them into an artery, usually in the groin, feed it all the way up into the brain, all the way to these aneurysms, and they pack material into the aneurysm. So again, blood can't get into it. So
Wow.
again, it can't explode. So now instead of me opening up the head, climbing under the brain under a microscope, hours and hours of work doing this, they can put this catheter, bring it all the way up into the brain through a little incision in the leg this big. So it's you're not
Amazing.
getting true brain surgery. You're getting this all done through the blood vessels. And just of late, really, in just the past several years, we're treating strokes that way, where
Hmm.
a lot of people with strokes, you can put this catheter up all the way into the vessels of the brain and pull out a clot out of the blood vessel that's causing a stroke, and reverse the stroke, which is pretty crazy if it's caught
Wow.
early enough. So yeah, pretty wild stuff going on, particularly with, like I said, this idea of minimally invasive surgery, less
Mm.
of these big open craniotomies that we used to do.
How will artificial intelligence affect this area?
Yeah, there's the $60 million question. I cynically, but also with some eye to reality testing, tell the pre-meds and the medical students, I don't know what, your
Mm,
job is going to be like in the future. I can foresee us, at some point, and I don't think that long from now, but I can foresee us at some point going, hey, Alexa, I don't feel so good today. And your computer starts talking to you. Oh, yeah. What are your symptoms like? Blah, 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 blah. And Alexa says, here, put your finger on this little pad, which will have all sorts of sensors in it. And we're starting to be able to do things like blood chemistries just through your sweat. So
mm,
I imagine the sensor technology is getting to a point where all of a sudden, Alexa is saying, "Oh yeah, no, you got COVID. Here, you need these medicines or that medicine," and where is that going to leave the medical profession? And I used to joke with my residents because we're surgeons, so they would say, "Well, that may be all well and good. That'll get rid of all the family docs and internal medicine docs, but they'll still need surgeons." And I'm like, man, have you watched what they're getting robots to do? I'm not sure. Go ahead and enjoy your career for now. I'm not
mm,
sure what's going to happen in the future. So I mean, clearly it's going to have a huge impact. How much things are going to change, who knows? But it's just it's like
mm.
everything else, just this huge body of information available to you, and it's going to get sharper and sharper,
Yeah.
and really, it outperforms us human beings already in various settings. So I imagine it will in the medical setting.
Are every one of your surgeries, are they recorded afterwards? Do you have to create a document on what happened and what transpired? Is there documentation that someone or some agency can learn from? How does that work?
Yeah, well, that's a fascinating question. Right now, none of that is accessible. Because under
HIPAA.
under HIPAA
Yeah,
laws,
yeah.
so none of that's accessible. But yeah, absolutely. Yeah, after every operation, first we have to do a short note, what in the old days we call a handwritten note. But we type it into the computer, and there you have a record. But then you do a dictation where you go through the
Ah.
entire operation and every step of the way. Of course, some people have access to this. The legal profession does if there's ever a suit, but
Hmm.
that's not free for everybody's information. But you hit on a really neat point, and that is, were you to be able to de-identify all this and put it into a huge pool, again, consider all that might be gleaned from the medical information.
Mm.
So I know some of that is going down on certain levels, but I'm not aware of a lot of that going on our operative notes yet.
Very interesting. You mentioned before how you have to kind of separate yourself. If I make a mistake, this is a person. You have this great video, Gary, what you put up where you kind of walk through the life of, going into the emergency room and somebody's there and it's 3 o'clock in the morning and you don't know who they are. And it's this older person and they're, there's vomit and all this kind of bad, and you kind of take their story back and you're trying to humanize it. It's a real person and not to kind of judge it that way. It's a really great video. I appreciate you doing that.
Well, thanks. I try to inject some humanity into it
Yeah.
every so often because it's very easy. And I don't think it's because most of us are jerks. I think it's very easy in medicine, A, to get burned out, but
Mm,
also B, I think we use so many defense mechanisms that we can lose that connection sometimes with the patients, for sure. Because again, you don't want me going into your operation going, oh my God, what happens if this happens? What if
mm,
that
mm,
happens?
mm.
Then I've crippled this patient. I mean, I would become useless. And you also want me to be able to shake off the fact that, I may have just seen a dying child just 5 minutes before your operation. You have to be able to kind of clear the decks, get in there and do your job. And so I can see us distancing ourselves sometimes from the humanity, and there's a necessity to it. But if it becomes, that's your established behavior all the time with every interaction, then you become that cold, jerk of a doctor that everybody
Mm,
goes, oh, his or her bedside manner is terrible. Well,
mm.
maybe they're wonderful people, but they've just reached that point where they've kind of wiped that part of themselves away. And I think that's unfortunate. I think we have to kind of keep that part of ourselves.
Yeah, you talk about burnout. You've written 3 books, right, on burnout and resilience. I mean, this is very, very prevalent in your profession, perhaps more than any?
Yeah, who knows really which professions are going to be the worst? We'll outsuffer any other profession on burnout. No, I think I think all of us in this society. I mean, the modern American society is 1,000 miles an hour, multitasking, everything's going on all at once, and I think we're all primed for burnout. But they're always telling us, at least in the healthcare profession, that at least 50% of us are burned out, and that
Mm,
some specialties they'll quote 70%. My my co-author on a lot of the books, who's a world expert on physician burnout, his name's Wayne Sotil, but he and I both kind of think that everybody has some degree of burnout, and it's kind of something that goes up and down and up and
mm,
down.
mm,
I've said it often recently, but I think one of the better metaphors is that we all kind of have a energy bank in us. There's this, it's the energy that gets us to get up and do our work, to start the podcast, to go ahead and, edit the podcast or whatever, or to be pleasant when talking to a boring guest and all that sort of thing. We all have this energy within ourselves to one degree or another to do our daily, living. But I would say that everything that we encounter, everything that we do, every song we hear, every person we meet, every experience that we have day to day, either makes a deposit in that bank or makes a
mm,
withdrawal. And we all can think
mm,
of many things that make withdrawals, right? When your in-laws are in town and all that sort of
mm.
thing. But uh,
Hmm.
I think a good analogy for burnout is where you are just overdrawn. I mean, it's just, you got nothing left in the coffers there. And therefore, even when you do the things that normally kind of build up your energy, it just doesn't make a dent. And you're just dragging, everything's a drag. To get through the day becomes a drag. To interact with the people you normally interact with super well becomes a drag. So I think that's a good metaphor. And when we hit that point, the other thing that I think happens is all our idiosyncrasies start to come out. And all of us are
Mm.
different. So our idiosyncrasies are going to be different. But, like for mine, I always say, if you grow up in New Jersey, you just have to be cynical and sarcastic. Well,
Yes.
when I'm low, when I'm at my lows, man, that cynicism and that sarcasm comes out, and it's not nice.
Right.
And so that's me. Another person's going to be angry. Another person is going to be, whatever. And so it's going to differ from person to person.
Certainly is. And you you talk about, coming and talking to people about wellness and trying to avoid burnout and, them bringing puppies in and trying to recharge them that way. And, but you make a point of how gratitude really helps.
Yeah, and this is something that's that actually has pretty good psychological basis. In terms that it has been studied, and different exercises and running through and expressing gratitude goes a long way, for sure. So yeah, when we're trying to rebuild that energy bank, when we're trying to make the deposits in the energy bank, certain things are going to appeal to certain people, and you just made a super point that one exercise of petting puppies may be a positive,
Mm,
maybe a
mm,
nice deposit. But if you're really low, it ain't going to do it.
Right.
And getting a lecture from me, is probably not going to be this grand epiphany where now you know what to do. So what we try to advocate is, exercises in building resilience almost on a daily basis. And one of the better ones is that idea of gratitude. We'll call it, is to go through an exercise of harvesting uplifts.
Mm.
And that is, for make a point for at least a couple of weeks to every day go into your day, I don't know, with a cue card or something or your phone, and try to write down 5 good things that happen. 5 things that put a smile on your face or made you feel a little bit happier, brought back some warm memories. Could be somebody thanking you, it could be somebody just smiling at you, could have been one of your favorite tunes from your youth coming on the radio or whatever. But write them down daily for at least a couple of weeks. And then when you get home at night, and especially just before you go to bed, just read through them and think, hey, some good stuff did happen today. Even though I got in a fight with this person and that person and all, a few good things really do happen. And what's fun about it, I think, is if you do an exercise like that, it only takes a couple of weeks, and your brain then just starts noticing them itself. You don't need to
Mm.
force it. You don't need to say, I'm going to go write down 5 things, because your brain will start picking them out of the
Mm.
day. And I think, yeah, so it's one of the better exercises. I think we all could do with a little gratitude, because we're all ridiculously lucky,
Yeah,
and
we certainly are. I can't forget that. Now you haven't been performing surgery for about 3 years, and you're now at Virginia Tech. What do you miss about being in the OR?
yeah, it's that's another interesting one for me. None of this may be interesting for anybody else, but whenever you get insights to yourself, if you're a narcissist enough, it can be interesting. But I actually, whew, it must be 30 years ago now, but I got really sick. And ironically, of course, I got sick with a neurologic illness.
Mm.
It was called acute disseminated encephalomyelitis. And it's another one of these diseases where your immune system attacks yourself. In this case, it attacks the insulation of your nerves again, just like MS, but MS does it in a spotty sense. This is just an all-out war on your brain and spinal cord.
Wow.
And it laid me out. I was incapacitated for months, and gradually got back, almost everything. But there's certain little residua that I would be aware of, particularly when I got tired. And as the last few years of me operating went on, I started noticing more and more of these kind of weird neurological symptoms. And then I started getting some double vision and numb hands. And I said, I can't operate like that. That's not good. So that's when I pulled the plug. On I you know To me, you're either at peak performance or you're not, if you're going to be operating on somebody. So, but I've had a great time. I do a lot of teaching now with undergrads and med students. But to your question, which goes back to something that we were saying before. I was what I would call a case hound. I wanted to do every operation. I
Mm.
loved operating. And my total number of operations was probably twice at the average of most neurosurgeons. So I was operating all the time, and I was scared stiff when I stopped. That, oh my gosh, I'm gonna be lost. I'm gonna, one of the biggest parts of my life is gone. Now, interestingly, and this is why it was interesting to me, I haven't missed operating at all. And I tell fellow neurosurgeons about this, that I don't sit there being nostalgic about being in the operating room at all. And so all I can do is theorize about it. But what I have noticed is And what I think may be part of it is no matter how easy the operation is, and there are easy operations and there are hard operations, but no matter how hard it is, I mean, how easy it is, I think there's always a level of tension. I think you want to do the very best you can. You want it to go perfectly. And no operation goes perfectly. I will tell you, that's probably a scary thing to hear from a surgeon, but no operation goes perfectly because it's a body. Everybody's different.
Yeah.
There's bleeding, there's this, there's that. Um, and the more it strays from your ideal of how that operation is going to go, the more tension you feel, the more
Mm.
stressed you feel. And I think I was just absorbing that day to day, just doing it, not even really noticing it. But not doing it, it feels like you have 1,000-pound weight off your shoulders,
Mm.
because nothing I do has that gravity now.
Right.
Where mistakes really matter, really, really matter. And so I think being released from that tension may be part of the reason why, I'm not sitting here pining away for more surgery. And I also think, I did everything and I did a lot of everything. So maybe, I don't know, maybe it was enough.
Mm. Yeah, you talk about wellness and not getting burned out and kind of diversion. Is writing fiction a good way to avoid that, like you do?
Would be for me. I think in general, any sort of writing exercise potentially goes a long way. So we often recommend to people that at the very least they journal. Just it gives you a chance to organize your thoughts, get your thoughts out on paper. It's a way of diffusing certain tensions.
Mm.
It's also a way of kind of manipulating in your mind alternative methodologies of handling certain situations, or your, more than anything, your responses to these situations. We do think it's really important periodically to be able to debrief your stressors, if you will. It's nice when you can talk about it with somebody else, for example, um, you know, coworker or spouse or a friend or something. But what we don't want is people to just sit there and complain. We want people
Mm.
to think about their stressors and how do I respond to those stressors? Do I respond in a way that makes me feel good or brings in more energy, or am I responding in a way that ultimately is not so good for me, is taking me down? And so being able to discuss that with a trusted friend is a huge plus. But also, if
Mm.
you think about it, just being able to write it, you're discussing it with your best friend, that's yourself. and
Mm.
uh, and I think that potentially goes a long way. And so when you get to things like writing a book and writing fiction, well, what I learned about fiction, which is a lot of fun, is, man, you can go anywhere, and
Mm.
you can anything can and will happen, and you can throw any sort of character in there. So my novel, which is at about 100,000 words, originally it was 250,000 words, just all
Wow.
came out. And then I realized that my last name was in King, as in Stephen King, and nobody was going to read that book.
So you went through the editing process, chipped away, and here you are now. And you mentioned before, we talked before about spirituality and science, and there's a Venn diagram there, and how much is covered by the two really varies on the person. I know people who thoroughly believe that science has an answer for everything, and people that believe that spirituality does. I'm somewhere in the middle, of course, but how do you tackle that? How do you discuss that with your background?
Yeah, I think it's one of the things that interests me more than anything else,
Hmm.
is how the two sides, if you will, got so diametrically opposed at
Mm,
times.
mm, mm.
This concept, as you say, on the science side, it's almost like, oh, we can explain everything. Everything's
Right.
got, we got it all down. We know everything,
Yeah, yeah.
and we don't need your spirituality. We don't need to think that people have souls. We don't need to
Mm.
believe anything, because it's all laid out here for us. We have the atomic diagrams and
Hmm. Hmm.
whatever. And then the flip side often is, is science is evil. Science is,
Right.
downgrading
Faith.
everything, and
Yeah.
yeah, you need the faith, and
Hmm.
even claiming that the science is false, which I think both sides kind of misunderstand each other, and I
Yeah.
think both really are still trying to get to what is this all about.
Mm.
And I've never heard a good explanation from science, for example, on why.
Mm.
Why
Mm.
exactly is
Mm.
it all here? And then I think it's kind of fun sometimes when you really get into, I don't understand any of it, but when you get into these, like theoretical astrophysicists, and I've read some of their pieces talking about how there could be multiple universes, that we're only experiencing one. And one theory is that there's infinite number of universes, each one different from the other by one subatomic particle or whatever. And I'm reading this and I'm thinking, how is this different from having faith in higher powers or something?
Mm.
We
Mm.
often believe in science too. I think we often believe in things for which there's going to be no proof of, and that's what
Mm.
faith is. So I think both sides are closer than we think,
Mm.
and just being dismissive of one another, I think, is just counterproductive. Both are potentially good for each of us.
Yeah, science is a wonderful, branch of knowledge. It doesn't answer every question. It answers a lot, though. We need it, no question about it. But I don't know. Try to go on a scientific date. I don't know. I'll throw that out. Right, right.
Yeah, if you can figure that science out,
Yeah,
first of all, you're
but
going to be very rich.
that is true. And I don't mean to mock science at all. Again, it's valuable. We need it, but it just doesn't answer every question. Same thing with religion and spirituality. It doesn't answer every question, but it answers a lot. And I certainly have spirituality within me, but I always wonder when I talk to men, people of science like yourself, where that marriage is. And I often hear what you say, that there is, you know, a cross there, but we're not quite sure where, and you can't be dismissive of both. Those are, I would think, the majority of us like to think that. I would like to think that.
Yeah, and I think science at its best, and really the root of science, is to call doubt on all dogma,
Mm, mm.
and which includes scientific dogma.
Yes,
So
exactly. Yeah.
ultimately, I don't think we ever prove a lot in science. What we do is disprove other theories, sometimes,
Mm.
and then we're just always trying to modify and better understand things. The other thing I always throw at us, and maybe this will be completely changed by AI, but the brain itself, the human brain, is unbelievable. It's magnificent, and all that, but it's also very flawed. It's not a perfect machine.
Hmm.
It very much filters out a lot of what's coming in because it doesn't want to overload the circuits. It creates stories of what we're experiencing so we can figure out a way to survive in our environment. It's very flawed. If you look at memory, for example, memory is very
Mm.
flawed. We create a lot of stories in our memories, for example. But anyway, so if we're overly scientific and we're going, we're going to explain everything. I'm thinking, what, we're going to explain everything with this very flawed piece of machinery,
Mm.
and on top of that, even if we could, is this very flawed piece of machinery going to be able to understand it?
Mm.
So I just kind of try to make room for both sides, and I think what happened on the religion side, for me at least, is when you get to specific religions and certain proponents of specific religions, they can get extremely dogmatic, just like
Right.
the science side is.
Right.
This
Right.
is the way it is. You must believe it this
Mm,
way.
mm, mm,
And again, well, you have no proof of it, so ultimately, it's just a leap of faith.
mm. Yeah. Well said. Yeah, evidence, faith. There's a blur there as well. It's we continue to be challenged by that. I look forward to seeing, and maybe AI can help with that. I wonder. I can't help but just wonder. I mean, just today we saw in the Wall Street Journal how the New York Times is suing some of these AI companies for using their source, their articles, their essays as some of the learning that the AI is. So who actually owns that? It's going to be fascinating to see where AI goes and how it's going to affect many industries. So Gary, I started my company, my tech company back in the 90s. I was working way too hard, working 14, 15-hour days. I'm not going to say I was miserable as you. We're not going to have that contest, but I was lucky.
Come on,
working,
let's duke it out.
working long days, not exercising, not eating well, a lot of pizza and soda. I found myself at 340 pounds. Imagine if I was 340 degrees. And the doctor said to me, if I don't lose the weight, I'm not going to see my daughter graduate. She had just been born, so I spent the next 6-7 months, lost about 130 pounds. And people ask me how, like there's some secret, like I'm gonna lay it on them. There's some silver bullet, and of course the answer is always discipline. Right. I have a new daughter in my life. I'm not just doing it for myself. This is what I'm going to get focused on. And you don't look at it as a finish line. Often people that lose weight gain it back because, okay,
Yeah,
I got it, so you have to continue working on it. Often I feel the 340-pound guy inside me is trying to get out. And I have to kind of
interesting.
quell that, but again, it involves discipline. I wonder how discipline plays a role in your life, given your extraordinary background.
Yeah, yeah. It's definitely obviously a huge component. I don't know how I came by it in the end because I certainly was undisciplined myself in college,
Mm.
and I think the- there, but for the grace of a religion and a God or somebody, I managed to be good at taking these multiple choice test questions. So
Mm.
did well on the MCATs because my grades certainly weren't stellar
Hmm.
back in my college days. But it was almost like a light switch went off at that point. I became very disciplined. Really worked hard in medical school. Did extremely well in medical school, uh, and then neurosurgery. I mean, there was just you either were going to be disciplined or you were going to fry. You just weren't going to make it. Uh, and I think it helped. I think, and I don't. It'd be interesting to hear your experience with the weight because I think it really helped being around others who were the epitomes of discipline. So I
Mm.
trained at Walter Reed. I was in the Army and I trained in neurosurgery at Walter Reed. Well, half of my fellow residents had gone to West Point, and you want to talk about disciplined
Mm.
individuals. It was embarrassing, to be around these guys. But I think it really helped. We didn't even need the suffering contest. It just you saw how good you can be and how much control you can take of the world around you. So I think that helped for sure.
Mm.
Uh, I think there's multiple other tricks that I'm sure you're familiar with, but I think it helps, for example, to know yourself. It was really interesting to hear about the other person inside of you, but it's one of the things that I like to see when you're working for resilience as well. But I think, how do you control yourself if you don't know yourself? How do
Mm.
you instill discipline if you don't even understand yourself and what motivates you and what's important to you and stuff like that? We often ask people to spend time, really getting to know themselves and thinking about what drives them and what, makes them happy and what do they want to accomplish. And I'm not talking about climbing a corporate ladder, but I mean, what do they want life to bring them? Because then it becomes much easier if you kind of know who you are, where you want to be. It becomes much easier to orient yourself that way, and
Mm.
and then to hopefully have some signposts along the way that you're getting there. uh, and I'll tell you another one that I think I learned during my residency, because it was hard. I mean, it was painful, as I'm sure losing that much weight was. But I also took a philosophy of embracing discomfort to a certain degree,
Mm.
meaning you don't have to be 100% comfortable every
Yeah.
minute of every day. You don't have to be 100% happy every minute of
Mm.
of the day. You're orienting yourself to something, and is there going to be some discomfort? Well, you can't be. I mean, I would have loved to be a professional soccer player
Mm.
if
Me
I
too.
had the skills and talents. But they don't. David Beckham didn't become David Beckham, by sitting around on the couch and playing FIFA,
Mm.
on the screen. He went, hours after every practice, kicking that ball over and over and over again. Um, and that's there's nothing fun about that. And after a while, I'm sure he ached and would have liked to go and have a beer or whatever. But so I think it's to tell ourselves, it's okay to be uncomfortable sometimes. If I'm working towards
Hmm.
something that I think is going to better me, I it's okay to be a little uncomfortable. We'll get there. We'll get to a point where it makes sense. I also think, sorry for rambling, but I think it's a critical discussion point. But I think it helps, like I said, to be in a team or be around other people
Mm.
of good discipline. But I also think it really helps to take some sort of leadership or support role within that as well. In
Mm.
other words, if you're there encouraging others to exert discipline, it kind of makes you have to do it too. You don't want to be, you don't want to be a hypocrite. And so I think encouraging and supporting others in their role, in their goals, in their self-discipline also instills it in ourselves.
Mm.
So I think, yeah, I think those would be some of the lessons I learned. But yeah, I mean, discipline was always a huge component of it. And it's interesting. I can't seem to escape it. So, like, if I sit down to write, I, I'll look up and it's 8 hours later, just kind
Wow.
of write. Um,
Hmm.
uh, so I think, things like that do get instilled into your personality, even if they weren't there originally. If
Mm.
you work at it, and again, if you do it and you do it and you do it, and you sense you're not gaining anything, or you're sensing, wow, this isn't getting me where I want to be, that's going to be a different story. And that's why, again, I think it's really important to know yourself and know what you want.
Mm. Mm. Yeah, and realize not only knowing yourself, but you actually can grow too, and things can change. I heard you say things like, you got focused, and when you say all things about the team, I hear accountability, right? That's what I hear there, right? When you're in that team and drive and focus, and it's funny also how you said it's okay to be uncomfortable. I think that happens with diet too. People think they have to have a party like in their mouth, all everything they have to eat all the time. It doesn't have to be sugary and sweet every time. You can eat spinach. You can eat things that are really good for you that may not taste like a candy bar. You can get, you don't be so accustomed for just complete comfort all the time. I think it's a valuable lesson.
Yeah, I just couldn't agree more. I think, uh, again, part of it, I guess, is our society right now is just, we get bombarded with messages that we should be
Right.
perfectly happy all the
Comfort.
time and in
Yeah.
perfect shape and perfect this and perfect
Yes.
that.
Yeah.
And probably good to just shut that
Mm.
out every so often
Hmm.
and listen to ourselves.
Yeah, because we see the imagery of people so-called having fun and being perfect, and pictures get doctored and things like that, and so we want to mimic after that. Gary Simmons, what motivates you?
Boy, that's a uh, I have no idea. No, I can tell you certainly through my career, probably by far the strongest motivator um, was the patients and their
Of
families. Now,
course.
that sounds trite or I don't know, cliche or something, but we dealt with the worst of the worst
Mm, mm,
diseases. A brain tumor, most times it's not going to go well, almost no matter what. A severe head injury in a car accident, a gunshot wound, a broken spine with paralysis, an aneurysm rupture, all these things, they're horrible. The outcomes are horrible. The people are incredibly sick in ICUs, with all these terrible complications. And you deal with the patients obviously a lot, but you also deal with their families a lot. And these families come in, a lot are not very medically sophisticated, and they come into this
mm,
massive medical center. Half the time, what's this ICU and that ICU and this medicine and that
mm.
IV, and there's 20 IVs hanging, and it's just got to be like entering another universe. Talk
Twilight
about
Zone.
other universes, yeah. So what hit me and hit me every day in my career, many times a day, was how incredibly courageous both the patients but also their families were facing this awful awful situation. Again, I was always in these big medical centers, and we lived real close to it, and the helicopters are going over it felt like every 2 minutes. And you
Mm,
realize that these helicopters, for every time they flew in, somebody's life and some family's life was just getting completely torn apart. So anyway, you would talk to the patients, they would be courageous beyond belief. They would be just filled with humanity, and the other term that I use all the time, because I can't think of a better term, but filled with grace.
mm,
Grace in the face of just awfulness and terrifying things, filled with grace. So I have boxes full of thank you letters from families who lost their family member, that we were
mm,
caring for, and yet the families are thanking us for all that we tried to do for them. And while we're there in the hospital, if you spend 2 minutes explaining what's going on, they're like, thank you so much, doc. That makes so much more sense. So if you can get up every day and go into that world, that's pretty motivating, because you just want to do your best for them. You want to do everything you can for them. And then I was lucky enough to be uh, to find a, everybody calls her a saint, but find a tremendous fellow human being in my wife.
mm,
We've been married, what, 43 plus years, who she was neglected for 40 some of them,
mm,
because of that world, and she's been nothing but magnificent. So I think my motivation now really circles around her, is what can I do to make her happy, because she put up with a lot. She put up with a lot of sacrifice through the years, and enabled me, allowed me to be able to do what I did, and I wouldn't be able to do what I was able to do without her around. But yeah, I can't. Again, I can't even think of another word other than grace, and it
hmm,
becomes almost spiritual then, But
hmm,
it, I always thought, if I were the one, you're telling me this stuff to me, I'd be picking up chairs and breaking windows and
mm, mm, mm.
screaming and swearing and stuff. That never happened. They just the level of humanity and bravery and grace was tremendous.
That's wonderful to hear that. It's all worth it though, isn't it? I mean, to go into that profession, I mean, the hours, those kinds of stories you have to tell to some of the families, but all the positives outweigh it, I would hope.
Yeah, and I think that's when we talk about burnout, and certainly neurosurgery has, its share of burnout. I think that's what we have to remind
Mm,
ourselves. I
mm,
think that's easy to forget in the heat of battle
mm,
sometimes. It goes back to reminding yourself that this family that's gone through hell is there thanking you. Well, I mean, if you don't notice it, then you're not going to be able to absorb all those positive waves. I'll give you another vignette that I think is interesting. We worked on my team on burnout for years, and we'd have these pretty wide open discussions about various things that might be stressors and not stressors. And one day I raised the subject about what about giving really bad news to families. That
mm,
has to be a stressor for everybody. Everybody said yeah, and this one of our guys stood up and he said, I'm almost ashamed to say this, but I'm going to say it anyway. He said, you know, it is of course stressful, but when I come away from one of those discussions, I often get that kind of warm, tingly feeling you get when you feel good.
mm,
And he said it bothered me because I'm like, how can I be feeling good about uh, you know, dealing out this awful news? And he said, and we started dissecting it, but he raised the concept that, but I think I'm good at it. And he said, there's a lot of times that we're not able to cure the patient. We can do our best, but sometimes it ain't going to happen. But we still can alleviate suffering. We can still be as professional as possible for these families, for example, and
mm,
really give them a full understanding. So there's no question about it. So they're not in the dark. So they're feeling guilty, which guilt is a big deal for the poor families. We can alleviate some of their suffering, not all of it, obviously, but we can help them with their suffering. And isn't that what being a doctor is all about? And everybody in the room went, something, I think you're right. And I think
wow.
we get those similar feelings too. And so it's really interesting if you dig down.
Mm.
Um, but on a very superficial level, you're going to say, yeah, of course, it's very stressful to tell that, somebody's loved one is in a coma or is paralyzed.
So how do you measure success?
In neurosurgery, uh,
Sure.
you gotta take the small victories, and you gotta appreciate what impact that you do have. And as they said, it may not even be with the poor patient; it may be with their families. You have to accept that you're always learning, you're always improving, uh, as well. And so you just got to kind of take out of it what you can. And I think you can consider yourself a success if you say to yourself, I've gone in there and I've done my best. I
Mm,
do what I can, and I'm improving too. I think there has to be an element of self improvement. You don't want to become static. You want to
mm.
always be trying to do it better for the next person along. And that to me would be the most successful.
There's no room for hubris in almost any profession, certainly a medical professional.
Well, that's another interesting concept. There's plenty of hubris,
Yeah.
and if you ask the average person in a medical center, what do you think of your neurosurgeons? I think half the time they'll say, "Oh, they're a bunch of conceited, insufferable pricks,"
Ha!
and I think on one level there has to be some level of self confidence
Right.
to be able to go in and do some brain surgery. But I think part of the game is you want to convey to the patients a level of self-confidence. Because I mean, I can't imagine having a surgeon come talk to you who's, all timid and saying, well, this may go well, but hell, it may go really bad, and
Mm.
probably will. Yeah, I think you probably want a surgeon with a certain level of self-confidence, but you don't want them tipping into overconfidence. But I think that's one of the idiosyncrasies that when you're burning out may come out as a bunch of false bravado. I often tell people that neurosurgeons have some of the most damaged egos,
Mm.
because there's a lot of bad outcomes, and you feel, even if there's nothing you could do about it when somebody's shot in the brain, uh, and you're there trying to save their life, and it doesn't work out. You could be doing everything perfectly and it's still going to result horrible. Yet you'll take it home and you'll say to yourself, if only I had thought of this, or only I had done this. You always
Mm.
feel responsible to one degree or another.
Absolutely amazing. Dr. Gary Simonds, such a pleasure talking with you today. I was so excited when we set this up. Tell us how we can get your three nonfiction books, your current fiction book. How can anybody listening get in touch with you?
Well, thanks, Joe. I love being here, and your questions are fantastic. And again, the trouble with these is when somebody asks a good question, I tend to prattle on because it
Love it.
opens up so many doors.
Yeah.
I'd rather hear more about your
Mm.
experiences, and how they match up with this. But anyway, I do love talking about this stuff, and would love talking to anybody who wants to talk to me about any of these subjects. But I have my own website, and it's just my name.com. So it's Gary R. and Simonds. It would be spelt like Simonds,
Right.
Simonds. So it's GaryRSimonds.com, and all that stuff and a whole bunch of other contemplations are on there.
Yeah, and all your links there. You're on Facebook, you're on Twitter, you're on TikTok, you're on Instagram, Pinterest, LinkedIn, of course. And I really, really appreciate your time. I look forward to what comes out next. And if I'm ever in the North Carolina, there, I see your beautiful home there with the snow. It looks gorgeous. If I'm ever in the area, perhaps we can get a cup of tea.
Oh, please. Absolutely. And this is a gorgeous area, gorgeous corner of the earth. I'm from New Jersey originally,
Yeah.
and never thought I'd ever live below the Mason-Dixon
Hmm.
line. But we ended up in Virginia for quite a long time, and then we go further south. But we're in the Appalachians, the tallest mountain in the east. The tallest mountain this side of the Mississippi is just a few miles away, by how the crow flies, at least, Mount Mitchell, and beautiful mountains everywhere around us. It's gorgeous. Plus,
Very,
it's
very.
like beer center of the universe. And
Yes, yes. That's a lot of great things to do there. And if you go to your website, please go to your website. Anybody listening, you'll see his home there and just how picturesque and gorgeous it is. I really appreciate everything you do, and I appreciate your time. And I hope to see you in the future.
I hope so too. Really a delight speaking with you, Joe. I was really looking forward to this.
You be well.
You too.
Thank you for listening and/or viewing Joey Pin's Discipline Conversations. Please share this episode with one or two of your friends who you think may benefit from the episode. Our website, www.joeypins.com. There you'll find lots of resources and you could join our mailing list. Please follow us on all our social media, Instagram, Twitter, and Facebook. Podcast information, the video version of our podcast is on YouTube. Please subscribe. Audio is on all major podcasting platforms. Please follow them. And if you like it, please consider giving 5-star rating. Would really appreciate that. Would you like to financially support the podcast? You can go to our Patreon site. Consider $5, $10, or $20 a month. There's all kind of plans that we have there. There's like a one-time payment. What is this podcast episode worth to you? $25, $50, $100, $500, $1,000, $5,000. You be the judge. You can go to our PayPal account to do that as well. Thank you again for listening or watching Joey Pin's Discipline Conversations.